Chloe Gurin-Sands, and I am with the Metropolitan Planning Council. On behalf of MPC, the Council on Global Affairs, and the City of Chicago, I'm pleased to welcome you to today's Global Voices Local Action event. Today is the fourth in a series of 7 events focusing on We Will Chicago, which is Chicago's citywide plan, the first in over 50 years. Today's event is focused on the public health and safety pillar, and we will hear from panelists and a moderator about We Will Chicago, the goals and objectives of the plan that are related to public health. And then panelists will provide presentations about initiatives that are going on in their cities, so here in Chicago, Toronto, and Helsinki. And then we'll have a short moderated discussion. And after that, we'll ask you all, the participants, to provide your input on some of the recommendations from We Will Chicago using a live polling tool called Mentimeter. During this event, the Q&A box will be open, but not the chat. So if you have questions, please feel free to put them into that Q&A box. And after the event series, we'll be sending back out answers to those Q&As that we don't get to during today's event as part of an email follow-up. We will be recording this, and the link to the recording will be available after the event as well. And then if you would like to see closed captioning, you can click on the CC button at the bottom here in Zoom that will use the auto-generated captions. Today's event is going to have 3 panelists and a moderator. I'm super excited about all of these folks. You can find more information about each of our speakers online, and we will be introducing them throughout the program. We'll share a link to the speaker page that has all of their bios as well. But right now, I will introduce Tiffany McDowell, who is our moderator. So Dr. McDowell is a community psychologist and thought leader committed to identifying and eliminating systems that push people to the margins of society. She understands the multiple ways that our current structures create barriers to wellness. Tiffany serves as the director of the Equity Institute at the YWCA Evanston and North Shore, and is a co-founder of the Chicagoland Equity Network, where she convenes a diverse group of members to advance a common equity agenda across Cook County. Tiffany's passion for social justice and equity drives her approach to ensuring that all voices are valued. Much of her work is focused on building capacity of organizations, community residents, and other stakeholders to develop strategies and action plans towards equity and inclusion. Tiffany holds a PhD from the Ohio State University in Human Development and Family Science, specializing in couples and family therapy. She received an MS in Child and Family Studies from Miami University, Oxford, Ohio, and a BS in psychology from Southern University and A&M College in Baton Rouge, Louisiana. Over to you, Tiffany.
Thank you, Chloe. Hello, everyone. I am glad to be here today as moderator for the public health event. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease. Public health is focused on the policies and structures that promote the health of people and the communities where they live, learn, work, and play. Today, we will hear from panelists from Chicago, Toronto, and Helsinki, who will lean into this expansive view of health and public health and what Chicago can be doing to improve the health of our residents. So you all know about Chicago, but I want to share some background information about Toronto and Helsinki. Helsinki, Finland has a population of 1.3 million and captures its diversity by using language spoken at home. About 80% of Helsinki's residents are native Finnish speakers, with the fastest growing language groups being Somali and Arabic. Helsinki has the largest immigrant population in Finland. Toronto, Canada has a population of 2.9 million and is one of Chicago's sister cities. Toronto is often compared to Chicago in urban planning and academic studies. Toronto's racial and ethnic makeup includes 12% East Asian, 12% South Asian, and 9% Black. We're eager to hear more about Toronto and Helsinki today and about the other international cities during the rest of this virtual series. Now I'd like to introduce Kate McMahon, who will give us an overview of We Will Chicago and the public health and safety goals and objectives before talking about what Chicago is doing to move forward these goals. So Kate McMahon is an advocate for social justice and health equity in all policies. At the Chicago Department of Public Health, she works with community organizations and government agencies to center health equity and decision-making across policy areas and sectors. Kate is a fellow with Health Equity Awakened, a national leadership institute for public health leaders advancing health equity and racial justice. And she's with Chicago United for Equity, a community of racial justice advocates committed to shifting power back to the people who love this city. She is pursuing a Doctorate of Public Health Leadership degree at the University of Illinois Chicago School of Public Health, and she's a graduate of DePaul University's Master of Public Health program. So welcome, Kate.
Thank you, Tiffany. Thank you, MPC for having me today. As Tiffany outlined, I'm going to do three things. So wearing a couple hats today. First, I want to talk through We Will Chicago itself, the plan, and give you a brief overview, particularly for folks who've been less involved, of what are we trying to accomplish, what are the main pillars, themes, and principles of the plan, and then where are we in the timeline and what's coming next. Then I'll also highlight some of the public health and safety pillar areas that were of particular interest to folks on the call today. And then I'll do a little bit of framing around some of the Chicago Department of Public Health's work related to We Will Chicago. So next slide, please. So We Will Chicago is the city's first city planning process since 1966. And really is meant to chart a different future and a different way of being for Chicago over the next decade. It's guided by two principles of equity and resiliency, which we'll talk through in a minute, and really is meant to both acknowledge Chicago's complex history, to reckon with that complex history, and then also to position Chicagoans to grow and succeed together in the coming decades. Next slide. So as I mentioned, the plan is organized and founded on two overarching principles. The first is equity, and by that we mean providing people and groups with access and resources and opportunities so that they can thrive. And the second is resiliency, and by that we mean the ability of an individual or group to thrive despite stresses, obstacles, and setbacks. And it's also organized by 5 overarching themes, and you can see those in the visual here on the right. So historical reckoning and trust building, systematic evaluation of equity benefits, accessible and meaningful community engagement, accountability through shared metrics and transparency, and sustained interagency and cross-sector collaboration. And I think that will come up quite a bit when we actually get into panel remarks. Next slide. So in addition to the 2 principles and the 5 overarching themes that I just spoke about, the plan itself is organized by 8 pillar areas, which really represent drivers of quality of life. And I think it's of note in this session in particular to highlight that the 8th pillar, civic and community engagement, really emerged during the planning process. And in fact, many of the recommendations within that pillar area actually came from the public health research team. And again, I think that is really going to be aligned with what you will hear panelists talk about when we talk about health equity as a process in addition to an outcome. Next slide, please. So what will the plan do? It is really aimed to help align budgets, projects, and policies, to ensure more equitable development across pillar areas, to establish standards for neighborhood plans, to create standards for decision-making, and really to include communities in development planning. You heard that overarching theme of accessible and meaningful community engagement as part of this plan. And then of course, to inform land use and zoning decisions. Next slide. In terms of timeline, the plan has 3 public engagement stages. The first occurred in 2020, and that's really where a series of community conversations were held to gather ideas from Chicagoans, and that's what helped to determine the 2 principles, 5 themes, and again, originally 7 pillars, now 8 since one was added. In phase 2, which has just concluded, research teams made up of volunteers and community groups, organizers, artists, folks working across sectors and policy areas really came together to craft draft goals, objectives, and policies based on that existing public input. There were also a number of community engagement events that were hosted and a series of surveys for folks to express their priorities within the plan. And then the third phase of We Will that we're currently in is really meant to expand public outreach to do more community engagement and get public feedback and comments on the draft framework plan that research teams put together. So there are a series of community engagement events. There are opportunities to participate via survey. There are events like this. It's really a summer of engagement, and all of this is leading to what will then be, formally a final plan. Next slide. So again, another way to look at our timeline for planning. Our framework plan has been released. We are in this, broad public engagement period to really refine what was put forward in that draft framework plan. That feedback will be incorporated, and then we expect the We Will Chicago plan to go to Plan Commission in January of 2023. Next slide. And so here are some ways to get involved. If you haven't already, there are pop-up engagement events happening summer and fall. There is a very public and pretty good website about We Will Chicago where you can see a calendar of events. There are also a number of surveys based on pillar area that you can take to share your feedback in that way. And if you have additional ideas or opportunities, here is information. We will at cityofchicago.org, and you can contact the planners directly to share your feedback for other ways to get involved. And really, I think the message here is we are encouraging you to share with your networks. Like, we want this to be Chicago's plan. So please, please participate and encourage those within your network to do as well. Next slide. And so how it's happening, again, there is a draft framework document that exists. There are surveys, there are engagement events and in-person events. And so through those engagement events, you can share additional feedback about priorities, make recommendations and refinements of what should be shifted and shaped. And then there are these like deeper dives based on pillar areas that are happening, like the event that we're in as well. Next slide. And so now I'm going to transition and talk about and really to highlight some of the goals and objectives that emerged in the public health and safety pillar. So if you remember, there are 8 pillars, which are meant to be quality of life drivers. There was one around public health and safety, though we know that, all of the pillars are ultimately impact health. And so you'll hear us talk about that more. But these are at least the goals and objectives that emerged during that research process for the public health and safety pillar itself. And I'm going to linger on a couple that were of particular interest to folks joining the call today. So the first is really to ensure equitable, affordable healthcare services for all Chicagoans. You can go to the next slide, Chloe. The second big goal area that emerged was to strengthen trauma-informed public health systems to respond to mental and behavioral health conditions. You can go to the next slide. The third goal is to establish and maintain the necessary governmental public health and emergency management capacity, staff, and infrastructure, and change community conditions to eliminate health inequities and respond to public health emergencies. And here I'll linger for a bit. This is one of the objectives that was of particular interest to folks here today, and I believe will be included in some of the survey polling that's done at the end of today's session. So here, objectives that emerged were expanding and sustaining funding for city public health staff and infrastructure, expanding and sustaining flexible public funding for government and community health initiatives, partnering with city agencies and community organizations to better meet people's unmet health needs, ensuring access to sufficient, healthy, nutritious, and affordable foods, and supporting the health of babies, children, parents, and other caregivers. Next slide, please. The fourth big goal area that emerged in the public health and safety pillar was ensuring Chicago is a city where everyone can thrive without fear of violence. Next slide. And the fifth and final big goal area in the public health and safety pillar is really to make infrastructure, physical spaces, and services safe, beautiful, and accessible to the aspirations and cultures of communities. And I understand that this is another goal area that was of special interest to folks here today. So I'll linger here too on the objectives that emerged from the research team. And those are really enhancing accessibility, safety, and quality of public spaces, providing and facilitating the ownership and activation of vacant lots and buildings by Black residents and local businesses, developing infrastructure and amenities that support everyone, especially people with health and mobility challenges, and finally, making physical activity opportunities accessible, easy, and equitable. And so we'll get into a deeper, opportunity to give feedback on those priority areas at the end of our panel discussion. But before that, as Tiffany shared, we're going to now pivot a bit, and I'm going to share some of the priorities of the Chicago Department of Public Health and really talk about how health equity and citywide planning are aligned. So I'll share a bit about our focus, about Healthy Chicago 2025, and lift up a few initiatives, and then talk about some of that alignment with We Will Chicago. Next slide. And then actually you can go one more. Thanks. So again, thanks Tiffany for introducing me, and I think I'll share a little bit more about my role in the health department. I lead an office of health equity and all policies, which is a team who works with community organizations and supports our colleagues in other city departments and sister agencies to center health equity in their work. And I always like to begin by grounding us in a root cause analysis. Using life expectancy, an important metric in public health that helps us understand how health is distributed and what the causes of that distribution are. So as of 2020, the gap in life expectancy between Black and white Chicagoans was 10 years. And for the first time in decades, life expectancy for Black Chicagoans fell below 70 years. And I want to pause for a minute because that is completely unjust and unacceptable. And as our commissioner, Dr. Allison Arwady says, and as you see in this image, life expectancy gap isn't about the causes that show up on a death certificate most often, but is actually about what's driving them. And inequities in health outcomes related to things like the COVID-19 or chronic disease or behavioral health can all be traced back to the same root causes. And we're talking about structural racism, income inequality and poverty, other forms of oppression, and power imbalances as those root causes. And we also like to begin with a root cause analysis because there's no shortcut to reducing the life expectancy gap. What this means is that collectively, the city and its partners must do the work to fundamentally transform the conditions in which people live. And that means things like addressing access to services, affordable housing, education, economic opportunity. And it also means taking action to support community power and transforming policy and systems that actually get at the root causes of how health is distributed. Next slide. So Healthy Chicago is the way in which the health department works to address the life expectancy gap with all of our partners. And our latest Healthy Chicago plan is called Healthy Chicago 2025. It's a 5-year action plan, and it names addressing the root causes of health, including structural racism, as our priorities. And what you see here is a visual really depiction of our vision for Healthy Chicago. And that vision is a city where all people and communities have power, are free from oppression, and are strengthened by equitable access to the resources, environments, and opportunities that promote optimal health and well-being. And to get there, we know we have to change the way in which we do our work. And what this means is identifying local priorities, taking action, evaluating progress, and doing so in a way that is community co-led. And that requires authentically engaging community members and organizations to incorporate their lived experiences, preferences, and power into policy and planning decision-making. And Healthy Chicago is the work of hundreds of people and organizations, and it is much bigger than I can, express fully here today. And so I think I want to lift up just 2 examples of the Healthy Chicago work and the way in which we are doing this work, because they are connected to We Will Chicago. And the first is our Healthy Chicago Equity Zones. And this is really a commitment that the Chicago Department of Public Health and the city has made to strengthen community infrastructure and neighborhood networks by funding community organizations and regional leads directly, so that people who are most impacted by inequities have the power and resources to promote health and racial equity within their neighborhoods and also citywide. And then the second initiative that I would lift up is really our work to advance health equity across policies. So you can go to the next slide here, Chloe. And again, I think what you'll hear all the panelists talk about, and certainly Tiffany had uplifted in her remarks, is that health equity and the determinants of health exist across all of the pillar areas in We Will Chicago. And what this means is that we need a collaborative, all-in, whole of government approach to advance health equity. And by that, we mean really centering health equity in decision-making across policy areas and sectors, so that we are changing the way government agencies relate to each other and collaborate and work with community organizations, and also how policy decisions are made and implemented so that health equity is centered from the start. And so in our public health language, we mean here that we're talking about the structural and social determinants of health, which are really, as we saw from our root cause analysis, those ultimate drivers of health outcomes and how health is determined. And then I think I'll leave you with just one last slide, and that's how our health equity and citywide planning related. So again, those pillar areas that have emerged in We Will Chicago around housing, neighborhood development, environmental justice, civic and community engagement, transportation, all of those are drivers of health. And so we think about this in 2 ways. First, as a process, health equity requires a new way of doing business. So that means that we have to prioritize access and opportunities for groups who have the greatest need. We have to systematically evaluate the benefits and burdens of our practices and policies. And also it means that we have to engage those most impacted by the problems we seek to address as experts in their own experiences, strategists in co-creating solutions, and ultimately the evaluators of our success. And in practice, what a citywide plan and how this can be is really, having everyone have a shared understanding of the root causes of health inequity, applying a health equity lens to the way that we do business. And then, of course, identifying ways to evaluate current practices and to create new initiatives. I think I'll leave it there, and I'm really excited to hear from other panelists.
Thanks so much, Kate. Thank you so much for introducing us to Chicago's citywide plan and sharing how Chicago is starting to grow its health equity in all policies work. We will now hear from Tommy Laidio, who will discuss planning from a holistic health perspective in Helsinki. Tommy Laidio is the inaugural Bloomberg Public Innovation Fellow at Johns Hopkins University and brings a decade of senior city leadership experience to this fellowship. He joined the city of Helsinki as Director of Youth Affairs and was later elected as the first Executive Director of Culture and Leisure, acting as a member of the mayor's executive team with an overall responsibility for culture, sports, library, and youth services. He led the merger of 7 departments into one, the design of the city's resident engagement practice. Laidio holds a master's in political science from the University of Helsinki and an MBA from Aalto University. In addition to speaking and writing on his experience in Helsinki, he carries out new research on how cities build partnerships for parks and public libraries. Right, I will pass it to you, Tommy. Welcome.
Thank you so much. Thank you, Tiffany. Thank you, Chloe, for having me. And I'm super excited to learn from others and also share how we worked on health and well-being in Helsinki. And I think there's a very natural segue between what I'm going to say and what Kate just shared about the aspirations for Chicago. As was mentioned, I've spent the last decade in the leadership of the city of Helsinki. Helsinki is the capital of the happiest country in the world for many years in a row. I started working on youth and then more broadly on how to create meaning and reasons for living for people in our city. We can, Chloe, go to the next slide. At the moment, I'm joining this call from Baltimore, where I'm doing a 2-year fellowship at the Bloomberg Center for Public Innovation, which is a new center launched last year as a collaboration between Bloomberg Philanthropies and Johns Hopkins University. And our goal is really to really kind of marry the practice of cities. We work with 40 cities around the world on better public services, better civic engagement with the latest academic research around these issues, and really kind of help cities around the world to create better public services and also greater public trust towards their governments. We can move to the next one. So my focus today is on Helsinki, the city that I grew up in and studied in. Helsinki is, I think Tiffany said 1.3 million. That's the metropolitan region. The city of Helsinki itself is 650,000 people. So, and it's one of the fastest growing capital regions in Europe. So the city is going through a massive transformation. At the moment, 17% of our population speak another language than Finnish or Swedish, which are the domestic languages at home, and that's changing really fast. So the city is both growing and becoming much more diverse. In 10 years, the city will have 100,000 residents more than today. The city has a lot of assets that show up in many rankings. And just to give you a couple of numbers, we're very proud of our education system that manages to deliver equitable, good education for everyone. And a sign of that is that 85% of families choose the local public school for their children. 47% of our housing is social housing or price-regulated housing, and that's fairly well divided throughout the city. 79% of travel and transportation is done through sustainable means. So 79% of travel is done either by cycling, by foot, or public transport. And 74% of our residents say that their neighborhood is safe at night to walk, and that's actually increased over the last couple of years. So the city has it's doing a lot of things right. It has a lot of assets, and the big challenge is that how do we hold on and kind of develop those assets while the city is changing, becoming bigger, and having a more diverse set of different lifestyles. We can move to the next slide. When we look at public health work, the national legislation already gives a certain framework for how cities and municipalities in Finland work on public health. So the legislation already says that municipalities are required to have a 4-year health and well-being plan where they set metrics for themselves and goals for themselves on health and well-being. That needs to be adopted by the city council. The city needs to report to the city council on its progress annually, and there needs to be a steering group of senior executives that goes like across departments and really works on health and well-being as a joint effort. In Helsinki, I led this work for the last couple of years, and we really spent a lot of time thinking on where this collaboration can really make the greatest contribution. And we thought that rather than trying to micromanage the work that happens at all of our departments and what the work that our staff does, we really focused on certain number of issues where the collaboration would allow us to tackle issues that are not entirely anyone's responsibility, but affect the residents largely, and really issues that resonate with all of our residents, but really that kind of where we need collaboration. So some of the issues that we focused on are hobbies, so well-being of young people and children. Americans say extracurricular activities. We would say hobbies to highlight the importance of fun and voluntary engagement. On physical activity as a public health challenge, I'll say a few words more about that. On youth opportunities and youth employment, that needs cross-departmental collaboration, and really work on these issues in a way that they resonate with all of our residents, that we create opportunities for all of our residents, but then do affirmative action in a way that we put more resources into those communities and those neighborhoods that we've underserved historically or are underrepresented in as users of our services. We can move to the next slide. So just as an example, physical activity has been decreasing in all developed countries due to our lifestyle change. We have less reason to move, and it's one of the biggest public health challenges globally at the moment. So we decided as a city to really collaborate with a group of researchers to understand this public health challenge and understand how systemic it is and how it needs a comprehensive approach. So we brought together researchers from public health, from social psychology, and many other fields to really build this program together with city staff, where we actually have 57 measurable action areas that work towards the same goal, which is more movement. And how we built this program is that we have kind of city level coordination of the program and the metrics. We have the joint goal of more movement, but then really giving a lot of agency to the city staff to think about how do you adopt this goal into your work in a kindergarten or senior care, really appreciating and valuing the excellence and expertise of our staff. So the program goes from outdoor cultural events to bike paths to senior care to how you talk about physical activity at a healthcare station. And I think the big innovation for us in this was that in order for our staff to be credible ambassadors to this issue, they need to have experience of that issue itself. We know that from private and commercial services, that people sell those services better if they've tried them. So really we invested on giving our staff the free use of city bikes, access to different health and well-being coaching. And something that turned out surprisingly popular is that for those who work on a computer, that you have a program that reminds you regularly that would be good to get up and do a bit of stretching, and our staff in Helsinki loves that. But the important thing is that you have a lot of activities where staff has agency over those actions, but they work towards a shared goal, which builds this kind of shared commitment to a public health challenge. I'll give you another example. We can move to the next slide, where collaboration is key. When we look at hobbies for children, we know that people and families end up choosing the things that they've had access to or they've tried. But we saw when we looked at participation especially in cultural education, so art schools, music schools, that the participation in these activities varied between 4% and 40% actually across kind of along socioeconomic lines. So there was clear disparities in the participation of that. And we thought that giving universal access and experience is the way to build that interest towards these services and open those doors. So we built this program where every single child born in Helsinki is invited through these maternity clinics to a 7-year relationship with a professional arts organization. We've committed all of our arts organizations to this. And the idea is that the families are invited twice a year to programming that's tailored to their child's development stage. And the key in this program is that these maternity clinics are places where families go when they're expecting a child or during the first years of their child. And the invitation to this cultural program and the discussion about the importance of cultural activities and recreational activities in general is actually led by nurses and social workers who are trusted by families as experts in parenting and not by cultural organizations. But then the cultural organizations have the expertise of thinking of what kind of program we should actually provide for a 4-year-old or a 7-year-old or a 1-year-old. And this program has become really this kind of beacon of hope for a lot of cultural organizations, but also for a lot of families, a reason for joy and also a possibility to meet other families. We can move to the next slide. So kind of the message that I want to put across is that when we look at Helsinki's public health work, it's not bells and whistles. It's really focusing on making sure that the basic system works really well. So making sure that we have good data, good research that we can build our programs on, using multiple contact points for telling a shared story, making choices on what you focus on at a time rather than trying to do everything at once, giving our staff a lot of agency over the actions taken, trusting their expertise, doing things in a fun, aspirational, but functional way. And then when we want to partner up with civil society organizations, supporting them not only through projects, but through operational grants to make sure that there's a lively and active civil society in the city. Providing universal access with that equity focus, and then making sure that there's that human-centered approach in all the things we do, and therefore using different design methods and design thinking to make sure that we start not from the city's point of view and City Hall's point of view, but from people's point of view. And I kind of want to leave you with this notion of how we think in the Nordic countries about freedom. We think people need to have the capabilities to actually be free. We can't just drop people and say you're responsible for your own life. And rather than when you give people the reasonable capabilities, you create the system that allows you to actually be free and to make those choices that allow you to build a life that feels like your life and that you have reason to value. Thank you so much.
Well, I want to say thank you to Tommy for inspiring us to think about how cities can approach health in a more holistic way and to coordinate across the city to consistently put health at the forefront. Now we will hear from Amanda O'Rourke in Toronto, who will talk to us about neighborhood planning and how public infrastructure that advances health gets implemented. Amanda O'Rourke is the executive director of 880 Cities, a nonprofit organization with a mission to ignite action to create healthier, more equitable, and sustainable cities. She has over 15 years of experience in the nonprofit sector, leading strategic planning, partnership development, and managing high-impact teams. She has led diverse, equitable mobility and public space projects in cities and towns in North America, Europe, and Australia. She enjoys working collaboratively with city governments and community partners to make it easier for people of all ages, abilities, and backgrounds to walk, bike, take transit, and build social connection and sense of belonging in public spaces. Amanda holds a Master of Science in Urban Planning from the University of Toronto and a Bachelor of Science in Environmental Biology from Queen's University. She is also the co-chair of the Children Play and Nature Committee for World Urban Parks and a full-time mom to 3 energetic kids. Welcome, Amanda.
Thank you so much, Tiffany, for the warm introduction, and thank you to MPC for the invitation. So excited to be talking to you all in Chicago. I'm joining from Toronto, as Tiffany and Chloe mentioned. I'm joining from the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, the Huron-Wendat, and Petun First Nations. And Toronto is now home to many diverse First Nations, Inuit, and Métis people. I am a settler and I am learning, and I'm also very, I acknowledge that I am on the site of broken treaties and covenants. So I know that there was a little short introduction about Toronto. Another thing I just wanted to add, as Toronto is a sister, often I think we have a mutual admiration. And Toronto is one of the most multicultural and multiracial cities in the world, a city that I just absolutely adore being able to live and work and play in. Our population is actually 51% visible minority, and 46% of our population is foreign born. So what an amazing city and special opportunity to live in this place. And I know Kate talked a little bit about goal 5, and I was asked to talk about goal 5, which was making infrastructure, physical spaces, and services safe, beautiful, and accessible to the aspirations and cultures of communities as part of the We Will Chicago. And that's perfect because I love talking about that, because that is at the heart and soul of our mission at 880 Cities, the organization that I have the privilege of leading. So 880 Cities, as you can see there, our mission is really to ignite action and challenge the status quo to create healthier, more equitable and sustainable cities for all people. And we're really intentional about that ignite action piece because a lot of our work is at the intersection of community and government, and we'd like to bring those folks together to ignite change and action. You can move to the next slide. So the way that we achieve this very lot is by sort of bringing people together to transform mobility and public spaces, because we believe mobility and public space are important platforms for advancing our goals around equity, sustainability, livability, and resilience in community. And of course, health. Health is huge. You can go to the next. And so we've been challenging cities on the way for the last 17 years on the way they design, plan, and manage their streets and public spaces. For the last 17 years in over 350 cities in 5 continents. So while we're based in Toronto, we work all over the world, and we've been challenging them by asking a very simple, but we think powerful question. And that is, you can go to the next slide. What if everything we did in our cities was great for an 8-year-old and an 80-year-old? We believe if you start there, you can create better cities for everyone. And of course, you know, the reason that we talk about age as a starting point is that we're all aging. It's a universal human condition. Everyone can think of an 8-year-old in their lives or potentially an 80-year-old in their lives. But of course, we also understand and appreciate that one's social location has a huge impact on their experience in public space and city building processes. So the 8 and 80 is a starting point to open up broader conversations on equity and structural barriers to creating equitable cities that work well for everyone. You can go to the next slide. And as I said, it's very similar to how Tommy talked about this sort of targeted universalism approach. So really centering the needs of the most vulnerable, the most marginalized, and thinking about how to, when you center the needs of those, how you can expand it and create better opportunities for everyone. So this is a great example of a program. This is in Mexico City, and opening the streets to people creates opportunities for people of all ages and all abilities to enjoy a public space, and our streets are a public space. You can go to the next. So here are some pictures. 880 City's story is really interesting. As I mentioned, Toronto is a city very much of a lot of newcomers. A lot of people choose Toronto as their home. And our founder, Guillermo Peñalosa, is one of them. He started his city building career in Bogota in the late 1990s. And you might be wondering why I'm talking about Bogota, but I'll explain it because this is really at the heart and soul of why we do the work that we do to advance health equity in cities. Guillermo was Commissioner of Parks and Recreation in the late 1990s, and he, along with many others, led a really impressive transformation of the city of Bogota in Colombia through huge investments in parks, in a bus rapid transit system, the Transmilenio, which is the top right corner picture, very expansive focus on expanding bike paths, accessible bike paths in some of the most low-income neighborhoods, and as well the Ciclovia, which is the bottom right corner, which was car-free Sundays. Every Sunday, 75 miles of streets were open to people and closed to cars as a way to invite folks to enjoy the health benefits of recreating in a public space. Guillermo always talks about the Ciclovia as the world's largest pop-up park. He, at the time, Bogota had 1/9 the per capita income of a city like New York. He was inspired by Central Park in New York as a space that embodied a sense of belonging and where people could meet each other as equals. And so he said, you know, I really want to try to create a Central Park in Bogota, but I don't have the per capita income. What if we use the streets? What if we used our existing assets and every Sunday we just transformed them temporarily into streets and large sort of pop-up parks for people? And to this day, the Ciclovia is a ritual. Every Sunday, everyone comes out and 1.5 million people every single Sunday enjoy the street as a public space. Can you imagine any other health program where you're able to get 1.5 million people out being physically active, socializing, getting access to important resources weekly? I cannot. And so Bogota has inspired many cities to do similar types of programs, and we've seen them kind of spread around the world. You can go to the next slide. So the story of Bogota and Guillermo Peñalosa, when he later immigrated to Toronto and started 880 Cities 17 years ago, this was at the heart of what he wanted to do. And public space, this idea that public space transformation could be a driver for improving social equity and improving quality of life for everyone. And this is still at the heart of what we do. It's baked kind of into the DNA of the organization. How do we actually use our existing assets in cities, whether they're physical assets or institutional assets, cultural assets, the assets of stories in community? How do we actually use that to improve our social outcomes? And this is at the heart of what we do today. You can go to the next. And so for us, the 880 City and the 880 Lens is really a way to talk about reclaiming the right to the city for everyone, especially those who have been disproportionately impacted by a disinvestment in public space, a car-centric planning paradigm that has had a huge health impacts on children, on older adults, on racialized communities, on low-income communities. And so for us, the 880 City is about reclaiming the right to the city. And we focus on these three pillars: the right to mobility, the right to public space, and the right to participate. And I really connect with what some of the other speakers have been talking about as well, the right to move and how important safe and comfortable access to walking and cycling and transit is to physical, mental, social, emotional health. The right to public space, that our public spaces should be safe and comfortable, and that we have access to a fantastic public space within 10 minutes walk of our homes, and that everyone should have access to great public spaces that meet their needs. And the right to participate is that everyone should be able to participate in city building processes that affect them. And how we actually create those engagement opportunities specifically focused on those who have been underrepresented and systemically excluded from city building processes. You can go to the next. So this is my last slide, and I just wanted to say, I know that all of this is like high level, really aspirational, and just wanted to also congratulate the city of Chicago. Kate, your presentation was wonderful, really dialing into those specific things and goals that you all have to advance health equity. And how does this actually translate on the ground? How does that work actually come to life in community? Well, we really believe that the future of public health is at the neighborhood scale. And so we focused on place-based interventions and that action word that I mentioned at the beginning. How do we actually bring people together through based interventions that ignite that action, that stir up and disrupt existing systems that have excluded and oppressed and marginalized communities? And so we use a lot of these things like pilot projects in close partnership with community, whether it's being able to, the top, I'll go from the left, walking to school, enabling environments for children to walk and bike to school without fear of getting hit by a car, and really disrupting that process by rolling out the red carpet and talking about how children should be able to feel safe with the simple act of walking to school, engaging children in reimagining their park space. How do we actually get them involved in planning for parks so that they get out and move their bodies and improve their physical, mental, social, emotional health? How do we actually transform our streets into places that invite physical activity through walking, through biking, through staying in public space, connecting with each other, meeting their neighbors? One of the biggest predictors of our health is the quality of our social relationships. So creating those social environments, just like the one in the bottom left, where during the pandemic, programming public spaces close to seniors' facilities as a way to invite and address social isolation that was exacerbated during the pandemic. Our communities, people who are closest to the problems, are closest to the solutions in our experience. And so during the pandemic, we have been able to support and engage and connect with communities who were able to deliver amazing, important needs at the community level, whether it was through vaccination clinics or access to fresh and healthy food, addressing important issues like food insecurity. And of course, the bottom right is really engaging diverse communities in reimagining their parks and public spaces as a way to meet their needs. And this is Sabina Ali in Thorncliffe Park in Toronto, one of the densest, I think, communities in all of North America. A tiny little park was reimagined as a cultural space with a tandoor oven with a high South Asian population. And you can see in the background, she's along with wonderful community organizers, created a pop-up cafe where folks can actually use their skills in cooking and sell their food in the park. And that was a big process to enable that with the city, but driving community change at the local level, creating enabling policy frameworks like Tommy talked about, but then also empowering community with the capacity and resources to actually get the things that they're so good at doing is really a part of the work that we do. So thank you so much for listening, and look forward to the questions.
Okay, thank you so much, Amanda, for showing us how some of these ideas can be implemented on the ground and what they look like in real life, and the focus on the built environment and impacting all of our health and well-being. So now I'm going to ask the panelists to all come on camera and join me in discussion. So these questions are for anyone, so any of you can answer these. So please feel free to jump in when you're ready to respond. So our first question is that in many ways, it feels like the United States has decided that health is more of an individual issue, not a collective issue. So how can Chicago begin to counteract that message?
Well, I think that you already have started. I mean, Kate's presentation was amazing, and really, by acknowledging those broader systems that impact people's everyday health and their meeting their daily needs, and this focus on health not just being access to healthcare, but in those underlying conditions that contribute to our overall health and well-being, and that comes in a lot of different ways. So I'll just get the ball rolling by saying that.
I can go next. I mean, I think one way, there's this kind of, I think at times people think that there's kind of this choice between being like supporting people being individuals and then collective choices. And I wanted to highlight with the Nordic example that it's possible to create freedom to choose by making sure that your basic systems work well. And I think relying on Chicago-based thinking on that is actually really smart. Martha Nussbaum from the University of Chicago has done incredible work on this, like how there's certain 10 capabilities that every person needs to have before you can actually kind of expect that people are able to have the full agency in their lives. So going from the freedom to move around safely in your city to actually having recreation and play. So it's not enough to be alive and have a job, but really have meaning, to be able to choose, have recreation and play, and we need systems to provide that freedom, those conditions for freedom for people.
Yeah, that's a great question, Tiffany. I think I'll get in there too. Maybe I'll uplift a couple strategic practices that I think we are doing in Chicago. The first is really developing that shared root cause analysis, right? Like we actually have to understand and challenge power imbalances and all forms of oppression as drivers of health inequity. And that means naming and addressing racism, sexism, classism, ableism, homophobia, xenophobia in all aspects of our work, and saying that that is health equity work. I think the second is really building strategic community relationships, sharing power and decision-making. And that is vital to advancing health equity. I think you heard, Amanda and Tommy both named that in their presentations as well, right? Those most impacted have to be the architects of the solutions and evaluators of success. And then the third is, I think it's narrative change, right? Like we really have to engage in the work to change the conversation around what drives health and what creates health equity. And, there is an entrenched narrative around risk factors and behavior change and the biomedical model, and all of that impedes progress towards health equity. So I think even some of what you saw us all do today is part of the work of moving from this individual lens to really a deeper understanding of what drives health.
Thanks, Kate. And when we're thinking about what that looks like, and I love that you lifted up narrative change, just, sometimes it can be hard for cities, especially governments, but definitely all of the partners to change and take on new ideas. So how might we get our systems ready for this innovation and ready for implementing some of the newer ideas from the plan?
I can try. I mean, the experience that I have is that real change starts happening when the city is actually able to make a choice. I think the risk with like health and well-being work or public health work is that we say that everything's equally important. So you actually don't have to change anything. I think in Helsinki, we saw that when we chose that the lens that we looked at public health work was largely physical activity, we saw that change started happening. People started being excited about that issue. And then the other part, after making a choice and focusing on something and using that as a lens to all public health work, the other thing was really engaging with our residents on getting our language right. Sometimes, or quite often, government's language is quite patronizing, quite condescending. Like I remember we did these workshops with senior citizens and they said, look at your images. Your images are either people in a wheelchair or people who have no physical limitations. Or we time and time again are in situations where we addressed as, oh, it's so wonderful that you are still so active, like we are on the verge of dying. Getting your language right, I think, is very key. And I think that's where cities need civil society partnerships, because we need those translators and mediators between City Hall and actual residents.
If I can pick up on that, actually, I absolutely spot on. And it's like, oh, moving away from this sort of charity-based model and focusing on a social solidarity model, and recognizing city governments recognizing that they need community partners at the table, like that they are instrumental and essential to change at all those scales, including the narrative change. And respecting through acknowledging those sort of addressing those power imbalances that Kate talked about. But yeah, moving less to this sort of charitable approach and more in like, we're in this together, we need each other, and being kind of relentlessly collaborative and actually acknowledging that our current systems and cities do not work for this kind of change, which I think is, really the focus on Tommy's work is like, how do you disrupt existing systems and change those systems to be more enabling? And the way that we've found it to be working is really getting on the ground and trying new things like at a hyper local scale in neighborhoods.
Yeah, I think plus one to all of that. And it is also bringing up for me, I'm just thinking of like Adrienne Maree Brown and like, we only do differently by being differently. And it is, I think, a profound transformation in the way that we do business and a real willingness to show up differently as folks working in public sector roles too, and to do our internal work within our agencies to make them affirmatively anti-racist, multicultural organizations, and to center community power in all decision making.
If I may kind of give an example of that, how we did this in Helsinki, we started a major program around kind of going back to what Amanda was saying about the risk of this charity model, that we noticed that it was 7 times more likely for young people with an immigrant background to be outside work and education. So we started the work around like, let's create them opportunities and like, let's help them. And then through really meaningful and actually quite long and intense engagement, our language is all about recognizing the skills they have and creating opportunities for them to use their skills rather than being helped by well-meaning white people. And I think that was like, but it took like nearly a year of serious engagement and being able to have those hard talks and really pushing our senior civil servants into those conversations.
Yeah, thank you all for that. I feel like that's one of the things that I heard so many times is not just the government also working to change, but all of us as partners have to be a part of that model. And so, we can't talk about health without mentioning the pandemic, obviously. We're interested to see where we're going to go with all of this. And I'm interested to know, how has the pandemic affected the desire or the need for public infrastructure? So how would people use public spaces and how they're being designed? Have you all seen any shifts in the way or the demand for public infrastructure and any changes that you all are experiencing in your cities?
Yes, absolutely. I can start. We saw huge increases in the demand for public spaces. Absolutely. Our parks and public spaces, the rate of visitorship and going out into public space rose significantly. But we also noticed, and this exacerbated by the pandemic or highlighted by the pandemic, was how unequally distributed access to good parks and quality public spaces is in our city. So you have very much high income areas with great access to parks and public spaces, mostly affluent, mostly majority white population. And we have a lot of the lower income, higher racialized populations having very poor access to good quality parks and public spaces. So I think there was an increased demand, but also an increased acknowledgement or highlighting of how this experience was very different depending on where you lived in the city and your social location.
To kind of build on that, I think I've worked a lot with the public library system, and I think the pandemic kind of pushed the libraries to realize that, oh, there's the world around our building, like what can be done outside the building. And then when you kind of plan a branch library, you should also plan the surroundings of it and not just what happens inside the building. And you see now more and more libraries, for instance, doing these kind of inside-outside spaces like rooftop parks or covered outside spaces and these kind of. But the other thing that we noticed that was somewhat surprising is that you saw more aggression in public spaces. People's sense of safety and proximity changed. We feel like people come too close to us. Our staff experienced more aggression from people who felt that other people are not wearing masks or something like that. So I think that's going to last at least for some time. So we have to be able to tone down the aggression in public spaces to make them really welcoming and approachable for everyone.
I think what this brings up for me is local leadership in Chicago from Elevated Chicago, which is a coalition and power building organization of folks doing transformative systems change. And I think I really want to channel some of the optimism of what does like building back differently and better look like. And, you know, in the case of Elevated, it's really talking about equitable transit-oriented development. And what does it look like for, in this case, the city to marshal resources to existing community priorities and to really have a sense of placekeeping, right? Of like what makes a place a place. And the only folks that can lead that are people from that place.
Well, thank you all. You know, it's been wonderful to learn more about not only what's happening in the city of Chicago and the work with We Will Chicago, but also to learn from Tommy and Amanda about what's going on in Helsinki and Toronto and other spaces that you all have worked. So I'll pass it back to Chloe.
Thank you so much, Tiffany, Kate, Tommy, and Amanda for joining us today. We're so lucky that we got to hear about these examples that are happening both in Chicago, but also internationally, and what we can share across the globe about what's working. So for all of our participants, now is the time where we're going to transition into our polling activity, and you all can give some direct feedback to the goals and objectives that are in the plan. Even if you are not able to stay for the polling part, we would love for you to fill out a survey to give some feedback about today's event. So I've just shared that link in the chat for you. I'm going to go ahead and pull up our polling presentation. Here we go. Okay, so you can use your browser or your phone to pull up menti.com, and you can put the code in 70852891. And then once you are set up in there, if you can click that little thumbs up so that we know that you're in and we can see how many people have joined. We have about 50 folks online right now. So would love for you all to participate. Okay, we're getting there. Almost half of us. Panelists, if you want to join, you can as well. All right, we're going to give folks about 30 seconds more to join, and then we're going to get into the questions. Please let us know if you're having any trouble or need help joining. So you can still join once we start the questions too. Okay. All right, so you should all see this question on whatever device you're using. And we're gonna do see a raised hand, so that might be someone that needs help. So thinking about goal number 3, we broke out that goal into 2 different phrases because we know it's a long one. So let us know how much you agree with this goal. So the first part of it, establishing and maintaining the necessary governmental public health emergency management capacity and necessary staff and infrastructure. And then the second piece of that, is the why. So changing community conditions to eliminate health inequities and better be able to respond to public health emergencies. Pretty strong agreement overall, though I would definitely be interested if this was a live event and hearing some feedback from the folks that are on the not agree section or part of this. And I hope you will still fill out that survey and give some of your input. There's a place at the end of the survey about the goals and objectives where you can put input about what exactly you don't like. You can tell us that here too in just a minute. So we'll look forward to hearing that. Okay. There we go. So now we're going to think about the specific objectives that are under goal number 3. So again, with each of these, you should have a slider that you can tell us how much you agree or disagree with the ideas that are in these objectives and wanting to move these forward. So expanding and sustaining flexible funding for city public health staff and infrastructure, funding for government and community health initiatives, partner city agencies with community organizations to better meet people's unmet health needs, ensuring access to sufficient, healthy, and nutritious and affordable foods, and supporting the health of babies, children, and parents, as well as other caregivers. So it looks like a lot of support for kind of government and community organization partnerships. So trying to figure out what those look like. Everyone loves babies and children. Let's support them. Well, one person doesn't support them, I guess. And then less emphasis maybe on staff and infrastructure. Okay. Oops. Oh yeah, so this is sorry, time to give qualitative input. So you should have the ability to type an answer in. And so thinking about, again, goal number 3 and the objectives that you're just thinking about, what stands out as something that you like about this goal and the objectives that go along with it. Great, so starting to hear some from folks that are saying they can't give strong agreement because it doesn't seem like there's concrete steps for moving them forward. But those that do like them, like that there's a public response, not just a private or individual response. Appreciating the naming of staff and infrastructure because that's how things will be achieved. Have some questions about how things will be funded to move forward an effective public health system, concerns about government infrastructure and corruption, liking, again, that public and community partnerships, rebuilding in public infrastructure, concern about flexible funding and accountability for that. All right, thank you all. Now we'll have the same format for this where you can give some input about what's missing from the goal, what you would like to see added to these objectives, or what you'd like to change about the goal and objectives. Accountability, implementation plans, transparency around how success will be measured, transparency around some specific health issues that we're seeing in the city around pollution and permitting, private auditing of public initiatives, city council support, housing. This feels like an infrastructure plan for people who will not be here. accountability, public safety and environment can be broken out as separate items. For that one, I will say there is an environment pillar and section of the plan, even though public health and public safety were combined into one area. And then some criminal justice, needing to be added into public health and safety realm. All right. So moving on to goal number 5. Again, this for the general overarching goal. Let us know your kind of level of agreement with this goal around making infrastructure, physical spaces, and services safe, beautiful, and accessible to the aspirations and cultures of our communities. So seems like more stronger alignment on this one. Oops. And again, thinking about these objectives under goal number 5, let us know how you feel about each one. Enhancing accessibility, safety, and quality of public spaces. Providing and facilitating the ownership and activation of vacant lots and buildings by Block residents and local businesses. Developing infrastructure and amenities that support everyone, especially people with health and mobility challenges. And making physical activity opportunities accessible, easy, and equitable. All right, so for this group, or at least who's answering, looks like a little stronger priority on infrastructure and amenities and supporting physical activity. And then again, our open-ended question about what you like about goal number 5 and the objectives that go along with that. Focus on public space, appreciating that inclusivity is more explicit in this goal. Need to prioritize with some of these. Scientific strategies to reduce violence, not emotional appeals. Like that we are thinking about disabled community and wondering about what safety in public space means. Safety for who and from what. Physical mobility. Economically vibrant societies. Addressing safety should also be a community level, similar to how the vacant lot strategy is phrased. Yep, so preventing folks from interacting with criminal justice system and going into that. And allows for some creativity. Okay. Oops. And we'll go to our last question here around what's missing from goal number 5 and those objectives that go along with it and what you would want to see changed. So we've not talked about violence at all this whole webinar. Where are the steps to achieve that, and mental health and addressing mental health clinics and reopening those? Who is implementing the objectives? The role of aldermanic approval and things being delayed. Overlap between this objective and what's addressed by infrastructure and environment pillars. Need to be explicit about who will work together and who owns what. Community identifying ways to address safety first, and address and include root investments and resources to root causes. Specificity and prioritization. Co-designing communities and initiatives whenever possible. Auditing our progress with the ability to change the trajectory that we're going down. Focusing on folks with limited mobility, maybe afraid to use some of the amenities because of public safety. System and environment around criminal justice and putting folks in jail. Employment income disparities around race, public safety, and crime solutions. Cooling centers, pandemic, and crisis, other health crises. All right, so I'll leave this up for a little bit for folks if you still have thoughts. And we also encourage you to go and fill out the survey about both the public health pillar and goals and objectives, but you can see all of the pillars and goals there and respond to those as well. So the city will be looking at that feedback and making changes to the draft before that final version goes to the Plan Commission. And we thank all of you for joining us today and sharing your feedback. Again, the recording will be available in the coming weeks, as well as Q&A answers to the questions that are in the Q&A box that we didn't get to during the event today. Thank you all, and please keep an eye out for the next events in the series coming up as well.